of Arizona, where I'm interviewing Dr. Joyce Schroeder, professor and department head of molecular and cellular biology. She also has an appointment at the Cancer Center here in town. So I will turn this over to Dr. Joyce Schroeder. And flip the camera. All right. So okay, great. So, Doctor, can you tell us a little bit about your typical research, what you do normally, aside from your work on the COVID app?
Oh, sure. So I'm a cancer biologist. We work on breast cancer primarily, where we're trying to understand the biology of metastasis and also develop therapeutic interventions.
I see. So how did you get involved with this COVID Watch app? How did that start?
Yeah, well, I was working on other things for reentry. So when I refer to reentry, it's what we talk about when we think of students who everybody had to go remote, students, faculty, and staff back in March. And the process to bring everybody back face to face in the fall, we started referring to as the process we had to do for reentry. And I initially was asked to lead the teaching and learning group for reentry, which basically encompassed bringing together everybody on campus who is involved in running classes and thinking about what students need and what instructors need and everything else, and getting that back in place so that we could start back face-to-face in the fall. While I was working leading that group, a faculty member here on campus, Joanna Maisel, approached myself and another person, the provost, and sort of informed us about exposure notification apps. I knew nothing about it at the time. And we started looking into it and realized if we could get this going on campus, it would be a great addition to our toolbox for reentry.
Great, great. So you said earlier that you don't have much experience with apps. What has that been like as far as a learning process, this new world that you haven't been familiar with?
Yeah, the entire thing has been brand new. So what I brought to the table was the ability to work with a lot of different groups. So as a department head, I have to do that. As a cancer biologist, I have to do that. Therapeutic development is just one of the things you do. You bring in a lot of different people who know a lot of things, and you try and create something together and make it go forward. So that's what I was bringing to the table. I know nothing about apps. I know nothing about app development. And so I had to find out who the experts were in all these things. So not just the data scientists and the IT people, but the app developers, start working with Google and Apple. But then the other side of it was also start working with people in public health, start working with the physicians here who would be running the program, start working with people who are working with privacy and legal and all the things that we had to think about, and then build a marketing campaign around that whole thing, which was all new to me.
Great, great. Can you tell us a little bit about contact tracing? What is that?
So contact tracing in its traditional form is when you discover somebody is carrying an infection, you of course isolate that person who has the infection, but then you also want to go back and find out who all their contacts were and get those guys into quarantine as well. And it's especially important with COVID because people can be carrying this virus for many days before they find out they're positive. And so unbeknownst to them, they can be communicating that disease to all of their contacts, not even knowing it. And so it's really important once you find somebody who tests positive, you go backwards in time and see who they were in contact with, so you can sort of scoop all those people up and get them into quarantine and get them tested as well. This is a really well-established disease control mechanism that public health uses for any number of communicable diseases. One of the things that is available to us now that hasn't been developed or available in the past is this digital contact tracing, which is the app.
I see. So when people think of contact tracing, it's about people being close to each other. One of the first things that comes to mind is that a geotagged kind of thing? Is it a geographical thing where people are going by? Can you tell us about that?
So there's lots of ways that different groups around the world have done this. The way that we have chosen to do it is using the Google Apple exposure notification software that's now built into anybody's phone who has an iPhone or an Android. It's in the operating system of those phones, and it does not use GPS, so there's no location associated with it at all. It's purely on Bluetooth, and so using low energy Bluetooth, it just sends signals out, and phones will send and receive signals when they're in proximity to each other, and that's what it's measuring. It's not measuring anywhere, any location that you are on the planet, and it's most importantly, doesn't know anything about you. It's really just the phones talking to each other.
I see. What sort of other security issues are there, and how have they been dealt with as far as like data privacy, things like that? Because that's a big concern for people, especially when they hear the word tracing. So
Right. And there isn't any concerns because it doesn't collect any data. So there's so many apps out there doing so many things that it's easy for people to get one confused with the other. But the Google Apple exposure notification that we chose to build our app on top of doesn't collect any data at all. So it doesn't know anything about you. The way that it works is it sends out these little signals from phone to phone, which are just sort of gibberish. And the phones listen to each other and pick it up. And once one person gets a positive result, they put that into their phone, then their phone will send a signal out to a central server and say, hey, if anybody heard this little gibberish that's been going off of my phone for the last 14 days, you should now know that that gibberish is associated with a person who's positive. Don't know who that person is. Don't know who the signal's being sent to. It's all just phone-to-phone contact.
I see. So there's no sort of way the university collects data on how how COVID might be moving around or anything like that.
No, there's not, and it's actually been one of the strange frustrations that has come out of this is before large institutions are willing to put their money behind something, they want proof that it works. Makes a lot of sense. It's really hard to collect that data that it's working because we don't collect any information on the person. So we can't know that a person who tested positive and put in a signal and that signal went out, we can't know that any of the people that received that signal did anything about it. We can't know that any of the people that received that signal got a positive test back. Mm-hmm. And so it's been a frustration because we want to know if it's working or not. But what we have instead are these sort of roundabout ways of knowing if it's working. So we know how many codes we send out. So we know how many people test positive and say, I need a code. I want a code to put into my phone. So we know that. We know when people contact our manual contact tracing that we have present on campus, we ask them, were you notified by the phone? And so we can keep some contact with that. But it's not very satisfying metrics because there's a lot of room around the edges where we just don't know.
I see. So basically, you don't have that raw data, but do you look at stuff like infection rates and try to kind of compare and see like downloads of the app, and are you trying to look at statistics like that to try to find out?
So it's really hard to know what's due to the app and what's not due to the app. So we don't even know where the app is being downloaded on a finite enough scale that we can make any sort of comparison. So we know at the level of the state how many people have downloaded the app, but we don't know, for example, how many of those people are on our campus. Right? So if we were trying to make any comparisons between that and infectious rates or anything else, there's too big of a flaw in the system for that to be accurate.
I see. What about the development of the app beyond the university? Do you see it potentially? Is there some sort of plan for it to spread to other schools or other institutions?
So our plan is for the state of Arizona to take it over. The best way apps like this work is if the entire community is utilizing it, because obviously, a single group of people doesn't stay within that group. They're all in and out of the community. So our hope is that the entire state will take it over. And in fact, around the world, Google and Apple's intention is that this would be taken over at the level of countries. And for example, the places that have launched already include Ireland and Germany, and the entire country did this and launched it together. They're also looking at expanding these, to very large regions. So, for example, the EU is looking at what would it take to expand an app like this across the entire EU, so as people cross borders, they don't lose that information. In the United States, while the launching is happening at the state level, they're also looking at national servers for when they upload those keys. So as people go from Arizona to New Mexico, for example, they would be able to still find out if they've been near somebody who has tested positive.
I see.
So all those things are in the works.
I see. That's good. Let me just check here for some questions. Let's see here. Okay, yeah, someone here said out of all the apps on your phone, the COVID contact tracing stuff is the least privacy intrusive. So,
That's very
yep, the
true.
Bluetooth. Someone says Bluetooth keys every 14 days. So, that's great. That's great. Let's see here. Have you been approached by any other institutions, like, talking like, hey, can we get your advice on starting something
Yeah,
like this?
there's actually forums for all the people who are looking to develop this technology. So the app developer that we partnered with, COVID Watch, has a forum among that includes all the people who are thinking about doing COVID Watch. I'm not sure that I'm allowed to say who those are, but that includes other universities, other states, other municipalities who are all talking to them. And then an additional forum that we're involved in is one that's run by the CDC and MIT Lincoln Labs. And they're bringing together everybody at the national level who is interested, not just at a level of a specific app, but sort of anybody who's interested in this exposure notification technology to try and share best practices and shake out the bugs as much as possible.
I see. What other ways is the university using its resources to help COVID research and anything really related? Research, testing. What are some of the other ways?
Yeah, we actually have a really comprehensive approach to try and mitigate this virus. I'm going to leave out research about the virus itself, which is also happening. That's also been funded on campus, but I don't actually know the specific projects. But what I can tell you about is we had an approach called TEAC3, which includes testing, tracing, and treatment. And what that allowed us to do is to try and optimize any of the approaches we could to come back to campus as safely as possible. So for testing, we're testing in 4 different ways. We have sort of the testing called antibody testing, where you find out, have you ever had it? And that allows us to figure out a baseline of how many people on campus have been exposed to the virus. We have PCR testing, which is a really specific way to determine if somebody actively has the virus. We have that on campus now. We don't send it out anymore like we did in the beginning. It takes a day or 2 to get those results back. We have rapid antigen testing, which tells you if you currently have the virus. Again, we have that on campus now, and it takes people 1 to 2 hours to get that back, so it's very fast. And then we have something called wastewater-based epidemiology, where we're going around to all the buildings where people live or are highly trafficked and testing the sewage. So that allows us to see if there's an outbreak of the virus on campus. And then if that's found, then they take the testing centers, the mobile testing centers there, and test everybody and find out what's going on there. So then all that testing is integrated. Our data scientists have created this great platform to integrate all this information. So basically, when you start into the system, you get a QR code, and then that follows you all the way through the system. When you get to the end of that system, then your information enters contact tracing. So it enters both the manual contact tracing, which is run here on campus by our College of Public Health, and our digital exposure notification. So you can your code can be generated from a positive test from that system. And then once you enter that system, then you get all sorts of information of, the contact tracing, find out who you've been involved, been around, what to do about that, what to do to quarantine or isolate. And if you're a student, how to quarantine on campus. So we have the treat part is where they developed a number of quarantine dorms where you can go and live there for 2 weeks and get your food brought to you and all those sorts of things, so that they make sure that that person is quarantined away from everybody else. And then we have things like Wildcat Well Check, where everybody who's going to be on campus has to take their temperature every day before they come to campus. We have all sorts of mitigations of, reduced number of people in a classroom. Everybody has to wear a mask. Social distancing protocols, heightened sanitation. Like, I feel like anything anybody has thought about, we've put in place here. And, we're just taking it day by day to see how well it's working.
Could you talk a little bit more about the wastewater thing? Because that's something that came up. It was a big news story nationally last week about a potential outbreak being spotted and prevented at one of the dorms. So can you talk a little bit more about that, how that works?
I think this is like super, super cool from a microbiologist point of view. So, for many, many years, microbiologists have been able to detect infections in wastewater and sewage. And the question was, could you test it in a way that's quantifiable enough that you can say, oh, there's a few people, there's a massive outbreak. Could you follow an outbreak? Can you forecast an outbreak? So one of the things the microbiologists who've been working on this for years have gotten to know is that people will shed the virus, the viral particles, before they have symptoms, up to a week. So if you're testing somebody's sewage, you can theoretically find it much sooner than they will discover they have it on their own just from symptoms. And so the real question, though, was, well, can we do this? Can we rush in and test everybody, isolate those people, and then if we come back, will the infection have been cleared from that building? And that actually is what happened. So it was super cool that the microbiologists went in, they found the buildings that were forming hotspots, they tested everybody, they isolated those people, went back 2 days later, buildings were clear. So this was a really proof of principle of something that they've been testing for a really long time, but fortunately had no pandemic to really determine how well it would work. But now we have a pandemic and they're ready to go. And the guy who's been working on this most at the U of A, his name's Ian Pepper, and he's actually been testing sewage all summer long in Tucson as a research project. And he's been able to forecast the peaks and the valleys of the infection, and it's really sort of amazing what they've been able to do.
So it sounds like there are sort of three major ways of testing. You have just the discrete testing. An individual comes in, you take a sample, find out. That's the obvious one. But then there's the wastewater type thing where you're doing an actual test, but it's sort of in a meta kind of way with that. And then it seems like the third way is a little bit of more data analysis, looking at statistics as far as like how is COVID spreading through a community. So it's not quite, you don't know how many people specifically, but you can kind of see that. Yeah. So are there any other ways that you can kind of try to draw out that information on who has it?
Not that I know of. As far as I know, everything that you can do is being done.
Yeah, that's great. All right. Well, let's see here. A lot of people were asking about privacy, so we covered that a lot. So is there anything else? That's about it. We can wrap it up, but is there anything else? And does the audience have any other questions? If you got anything, throw that in. But is there anything else you can think of?
No, I think the question I get asked most often is, how's it going? And how is all these things working? And, we are all in this together as far as we're playing it day by day and finding out and getting the data back and trying to pivot in real time. As something works, we do it. If something doesn't work, we don't do it. And we're all hoping we've basically done everything that we can think of to get ready. And now we're just expectantly seeing every day by day, is it working, is it not working? I know I personally really want to reopen the campus, so I really hope everything we did works, but if it didn't, then we won't.
All right.
Yeah.
All right, well, thanks a lot. We'll be finishing this up here, so thanks for watching this broadcast. You can follow me on my socials. You can also sponsor with some of the features in the app. So thanks for